All right, this bit is just informational. It's important in aviation. We'll cover exactly why it's important in aviation, but so you understand, your systolic blood pressure is the maximum blood pressure that you have as your heart pumps. Diastolic pressure is the minimum blood pressure. So what's happening when they put that cuff on your arm and squeeze your arm, and what are they listening for? Well, what they're listening for is at what point does blood stop flowing? When you reach a pressure where blood stops flowing, you've reached systolic. All right, now you're putting enough pressure onto the vessels so that blood cannot flow. You've reached the systolic pressure. The heart pumping no longer force blood through the constriction. And then you begin releasing pressure. And what you get as you release pressures is you get ba-doom, ba-doom. The heart beats and blood can flow through as the pressure exceeds the pressure you're under, but that gets to where it's more and more and more of what's going on until you get to the point where you're no longer hearing the pulsing of blood going through. Blood is flowing through smoothly. And when you get to the point where blood is flowing through smoothly, you've hit diastolic pressure. And if you've got an old style gauge you can actually watch the needle on the gauge. So if you watch the needle on the gauge, when you're between systolic and diastolic, it will do this little bump up. So it goes up as the blood gets forced through, and then down. And you can watch it go tick, 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 tick. And when it stops ticking, you've gotten to diastolic. All right. So how is all of this important in aviation? A little bit of aviation medicine. You're going to have, if you're flying commercially, you're eventually going to have someone that has a heart attack on your aircraft. Um, and part of the problem is really simple. Blood flows from the right side of your heart to your lungs, and then from your lungs to the left side of your heart. As atmospheric pressure drops, the dynamics in the lungs change. And you can begin to get fluid buildup and other issues going on with respect to this. And what happens is you stop getting the flow of blood you need, actually, you stop getting the flow of oxygen that you need, and you end up getting having a heart attack because oxygen has slowly been cut off from the heart itself. All right, you got to remember the heart pumps blood through itself as well, and so um, the that the fact that you're changing atmospheric pressure out here, and this happens, you've got a patient who is or a patient, you've got a passenger who's kind of marginal on that. Atmospheric pressure drops, their body can no longer function properly in terms of the exchange of oxygen here in the lungs, and they end up having a heart attack. That's typically one of the aerospace medicine issues you're going to be up against. And one of the things you're probably going to want to do, I don't know if it's in your manuals or not, but you're probably want to get to a lower altitude to kind of help the patient out, and hopefully you got a doctor on board. And um, that's it for fluid statics. And uh, the next set of things will be dynamics.